Jibril for that background. Here with us in the studios to discuss the issues on coronavirus, travel restrictions, and other matters arising. Let's welcome once again to our studios Dr. Osagie Ihianire, is the Honorable Minister of Health. Minister, a pleasure to have you with us on Good Morning Nigeria.
Good morning.
Thank you. Also here in the studios is Dr. Femi Babalola, his President, Guild of Medical Directors, and also the Chief Medical Director of Rachel Eye Clinic here in Abuja. A pleasure to have you with us on the program.
Thank you very much indeed.
Okay. And also seated with us is Abimbola Silva, Member Guild of Medical Doctors and Family Health Practitioners, Toro Ben Medical Center. It's a pleasure to have you join us. I hope I got that right.
You got it wrong.
Let's also welcome Christopher Otabo, Consultant Orthopedic Surgeon. Thanks for joining us.
Thank you for having me.
Pleasure. Thank you.
All right. Well, once again, pleasure to have you. Yesterday we discussed coronavirus. Today we're back on coronavirus. It's the hottest topic around the world. After our program yesterday, the Honorable Minister, we got to learn of 5 new cases, bringing the total so far to 8. What is the latest as at this morning? That's one. And secondly, from the headlines we are seeing in the papers, there's a lot to do now with regard to contact tracing. What is the feedback you're getting from the field?
Well, the contact tracing is going on. That means identifying all those who have been in contact with the suspect cases, or rather with the confirmed cases, and trying to find out where all they have been to, put them under self-isolation, and take samples for testing as the need arises. We have to be very careful to how we use our test kits because we don't have unlimited supply. As at this morning, I'm awaiting briefing because there are tests going on. Each test that is done has to be revalidated before you announce it. You have to confirm it. And by maybe in an hour or two, I will know what has happened overnight. But I know that tests are being done as we speak.
It would appear, I mean, in the, shall we say, early stages of Nigeria recording its own index case, that this tended to have been confined to the Lagos area. And now there's a report coming out of Katsina, somewhere in Dusima, of a Nigerian who had been to Malaysia. There's also a report from Kano. What else do we know about the suspicion of any of these cases in the northern part of the country?
Well, there's a lot of anxiety about the coronavirus. So people who notice someone who's traveled a bit and who has a few symptoms like cough, catarrh, fever, immediately point him out. Even before Katsina, we had people who were being pointed out in Jos, in Plateau State, in Enugu. So virtually everywhere, people are being brought for testing, as it were. Even in Abuja right now, there are some undergoing testing. But not all of them really fit the case definition. Nevertheless, if the reasons are there, we do a testing to confirm or not. The case in Katsina is not confirmed. We're waiting for results. And in Enugu, the case there was negative. And so we follow that pattern of testing and confirming or not confirming.
Okay, we have the youngest now affected by the coronavirus. What is the situation of the child?
Well, they're in treatment. The mother and child came in from the United States. The baby was born there. And the routine tests have shown that they are positive to test. Treatment is going on at the infectious disease hospital. There is nothing new from that angle. Of course, the contact tracing is going on. Who received the lady at the airport and where they all went to, and the connections they have had since they arrived.
How successful so far?
It's very intensive. We have had to send 2 vehicles to support Lagos area. You asked just now why Lagos is so intensive. It's because it's the international airport, the highest volume of air traffic into the country. So most people who are coming into this country from various places come through this airport. And that's why our focus has been on entry points at the airways, at the airports.
Honorable Minister, tell us something. I mean, again, this is in terms of public enlightenment. We do get reports that, okay, persons who have coronavirus, some of them do get to be treated, and after some weeks, a couple of weeks, it is said, maybe 2-3 weeks, they recover. and then they get discharged. But it would appear that the index case in Lagos, that's the Italian gentleman, is still in isolation undergoing treatment. His case would appear to have now dragged on for well over 2 weeks, because up till last night I was watching the Lagos State Commissioner for Health, and he said the gentleman still had not been discharged. What do we know about his case now?
Well, yeah, he's negative now. He's ready for discharge, actually. It was reported to me yesterday that it's tested negative. What you do is you continue measuring the viral load and seeing how effective or infectious it can be. So his own took a little bit longer, but he's negative now.
Yeah. Okay, although Nigeria has been trying, there's experts have been saying that we should enhance our capacity to detect, isolate, and track all patient contacts and effectively enable to curb the disease. Our centers are there. We're getting more new centers. How effective are these centers to be able to curb the spread of coronavirus in this country?
Are you talking about the testing centers?
Yes, the testing centers.
The testing centers only do tests. You send them a sample, they do the test and give you the result. In some cases, they work day and night.
Will we be in any moment in time, maybe in the near future, be told to go for tests even if you've not been, affected by it or infected by it?
No, that's not. The test is quite expensive, I will tell you that, because the reagents are not easy to come by, particularly with the mop-up going on from wealthy countries around the world now buying up reagents from everywhere. So we are trying to also increase our stock. So we do calculated testing. There must be a reason. We must have a good reason. First, you must have traveled out within the last 14 or 16 days, and then you must have signs and symptoms that are suggestive. So the test will be done. So if you have been inside your house or inside town for the last 6 months, you are not a likely case, except again you have had contact with a person who has been outside the country. So there are questions you ask before you expend your test materials.
Okay, Honorable Minister, we'll pause you. Let's bring in your fellow doctor colleagues, who are here with us in the studios. First, Dr. Femi Babalola, who is President Guild of Medical Directors. We say the federal government has now taken the decisive step of shutting flights and travelers from 13 heavily impacted countries. These are countries defined as those where you have at least 1,000 cases and above. What's your reaction to this move by the federal government?
Yeah, I think it's a step in the right direction. As a matter of fact, before the federal government took that step, you may have noticed that both the National Medical Association and the Guild of Medical Directors, we had put out statements to the effect that we felt that this was a step that was necessary to be taken by the federal government. And I think, of course, that the federal government also saw that the need to take that step, which has now been taken. And we feel that that is probably very necessary, because now that we have sort of closed the borders to all these countries with hyper-endemic disease, we can then concentrate on the cases that we have identified in country and do the case tracing as is necessary, and of course also maximize the little resources we have in terms of testing kit and all that.
Okay, thank you. We'll now come to Abimbola Silva. Let me talk to the lady now. It's supposed to be ladies first, actually. We're getting hit. 8 cases already. Are we managing the situation the way we should in this country?
Thank you very much for the question. I personally, well, this is my personal view. I personally think we can do more. Because even from studying from other countries where the way this disease multiplies, the way the cases increase, it's almost as if over 48 hours, over 24 hours, some numbers double or in tenfold increase. So I wonder if we're actually picking all the cases, especially since we don't have, unlimited supply of testing kits like the Honorable Minister has told us. I still think it's very possible to miss a few, especially since we know that some people actually, even from the NCDC documentation, they said that a contact is someone who has been exposed to a confirmed case, and even if the person, and even within 24 hours of the, even when the person was asymptomatic. So we're saying that we would only test if the person has symptoms, yet we know that it's possible that the person may not have symptoms and still have the virus. And I know it's because of resources. We don't have enough of the testing kits. So I think on one side of it, it may be good for us to try and see how we can mop up a bit more, open the net just a bit wider. For example, I have reason to believe, I know that some of the people that were in the same flight as the third case, they're being monitored. They're doing a great job of contact tracing. It's awesome the way they find everyone. Wherever you're hiding, they will find you, It's awesome what they're doing. I just personally think that maybe the net of testing should be expanded just a bit more, especially to anyone that, you just have this suspicion. Yes, there's standard protocol based on public health advice and, the rules you have to obey. But I just think that because of the fact that some people may actually be positive while being asymptomatic, I think we may need to maybe modify some of these reasons or criteria for testing to just a bit a wider net to be able to catch a bit more. This is what I personally think.
All right, thank you. Dr. Christopher Otabor, from a public health perspective, what's your reading of Nigeria's response to the pandemic?
Thank you very much for having me. I'll give kudos to the Federal Ministry of Health and the NCDC for a good job so far. But I think that the stage we're in now will cause every healthcare giver out, anyone who have studied the trajectory over the world, to be worried. Yes, because if you look at the US scenario, from 3 cases within 4 weeks to 5 weeks, it escalated to 8,700 cases this morning, and with over 100 deaths. And I think that we are getting to the tilting point where there may be a lot of cases that have been missed, and it might soon snowball into something. And that means that the fight will have to be taken from the NCDC to the hospitals. But my worry is, how prepared are we as a country? Nigeria is a low-income country, and even without the pandemic, our healthcare system is not as strong. What about we will now have inflow of patients? Because the cases can come in exponential numbers. We don't seem to be ready on the hospital side. The statistics from the US I followed, they said they have 64,000 ICU beds with about 55,000 ventilators, functional. Across Nigeria, that would serve 300 million people. Across Nigeria, I don't think we can boast of 500 functional ventilators, and maybe not up to 1,000 ICU beds. Where does that leave us as a country? Also, in terms of prevention, I don't see much traction in that direction. What would have given me some comfort would be to hear that, okay, the federal government have made arrangements to supply like 5 million, 10 million masks and N95 masks and hand sanitizers and even personal protective equipment for the hospitals, because the patients will come to the hospitals. And when they come, are we ready? I don't think so. So even the isolation centers, the treatment centers, the information coming from those areas don't seem to appear to me like we are ready. So the NCDC is doing its job, the Federal Ministry of Health is doing its job, but should the battle shift from the level of prevention to where you now have community transmission? I think that we're going to have a big challenge in our hands in that direction.
Dr. Babalola.
Yes, I think I agree with Dr. Otabor to a large extent. You will recall that during the Ebola crisis, the index case went to a private hospital. And the likelihood that cases will come to private hospitals is very high. As a matter of fact, this is one thing that really worries us, the Guild of Medical Directors. And to be honest, we're not ready, because on our part, we have tried to link up with the NCDC, and we had some training sessions done with them about a week or two ago, both in Lagos and in Abuja here. The training was useful, but at the end of the training, we were not kitted out properly, to handle these cases. I think the hope was probably that the same thing that happened in the Ebola situation, whereby we had only 1 or 2 index cases, and that was the end of the matter, will be the same thing here. But obviously, we see now that we're getting more cases in Nigeria, and like Dr. Bimbo said, the likelihood that we have missed out some cases are also there, because the testing regime, the testing protocol we have in the country now is that you must be symptomatic and you must have a history of contact with people who came from abroad, or you came from abroad yourself, before the kit is used on you. Whereas it is possible for you to be asymptomatic and have the problem. So the loose area in our protocol in the country at the moment is that our testing criteria is too strict, and we need to broaden it. And then secondly, I think that maybe federal government should also take cognizance of the fact that 60 to 70% of healthcare in this country takes care in private hospitals. And I believe it's good that the Honorable Minister is here. I believe that some move should be made to properly kitting out some hospitals, private hospitals, spread out across the country. Maybe in Abuja, take about 5, 6 private hospitals, kit them out properly, give them private personal protective gear, make sure they have a properly set up isolation unit and all that. And then the processes that are involved, even when you have a suspicious case, are not clear at the moment. They need to be further clarified. For instance, if a suspicious case turns up in one of the private hospitals, the protocols as to what to do, where to refer, how to collect samples, where to send the samples, all these things are not too clearly defined at the moment, and they need to be.
Minister, can you
I think it's important to explain the strategy, because we are working according to the strategy. We have public health experts, we have epidemiologists, and we have studied scenario. We know the weaknesses of our country. So from day one, we are focused on prevention, early detection. And our risk assessment tells us that we are likely to have any case coming through an airport. So we strengthened the first line of defense. That is, we were one of the first countries to start real full screening of incoming passengers, taking travel history, and we know which countries we visited in the previous 14 days. And we had a case of someone who came in from China, and they had to be tracked down. So we have done that very diligently. If you imagine that one patient comes in with coronavirus, imagine that he infects 15 others, imagine, in a day, and he is not detected. And those 15 infect 15 others in a day, and they are not detected. And then again, it goes on like that until the 3rd or 4th generation is detected. Then you can see why the numbers expand. Now, the index case that came in, the Italian man, immediately was discovered. Within 48 hours, we had the diagnosis. We had him already in an IDH. All the contacts were traced, and it ended with that one. Fast action, very quick. I commended the Lagos team, and I commended the Center for Disease Control for that. And the WHO also commended that. So all the cases we have now are new ones. They are all new imports. They are not originating from the first one. And that's the situation that every country faces. You have several imports, and there are reports going on now that even China is getting re-imports. And it's a nightmare, because the re-imports come in with no symptoms, And if you want to test all people coming in, like some countries have had, South Korea, for example, found that testing everybody will not work. Even the United States tried that too. So every country is trying to find out what works for it, what works best for you, and what you can also afford. You must also remember that a lot of this equipment we have to procure. We do not manufacture. The United States manufactures nearly everything, and they can ask for the industry to step up quickly. We have to go and procure. And we are doing that, trying to imagine what we need most urgently, and what we need to get very quickly. That is why, again, banning all flights can have a little problem in that if you are not able to bring in the things you need, you might have a little constraint. So we look at various scenarios which make us take the decisions that we take in the best interest of what situation we find ourselves.
Abimbola Silva said we might miss some cases.
Every country can miss cases, and there is no country that is prepared the way people imagine, because it's a new disease, it's a new virus, and the behavior is not yet very well known. Scientists are working on it, and every country will miss cases, but you try to reduce the number of cases you might miss. There are also studies that show that up to 80% of infected cases may have little or no symptoms at all, absolutely zero. So that's why the disease is so dangerous. It's spreading very rapidly. But we always believe that we must compensate for our weaknesses while we are strengthening our health system. And every country which has suffered so far is because their health system was overwhelmed, whether it's Italy or Spain or whatever, they're overwhelmed, and China. So we are trying to strengthen our health systems, but at the same time work on prevention.
Well, Honorable Minister, Dr. Otabo and Dr. Babalola raised some very pertinent, issues. First, they gave kudos to the Federal Ministry of Health, some state ministries of health, as well as, of course, the NCDC for the measures that they have taken so far. But the NCDC is not a hospital. The Federal Ministry of Health, per se, is not a hospital. And if the preventive measures get breached in some cases, then the patients would most likely end up with them. You know, they are all private sector practitioners because people patronize private healthcare facilities, plus, of course, government healthcare facilities. And that's why they are raising some of these concerns they have raised. And I would like you to address those concerns. I mean, Dr. Babalola was talking about testing criteria being too strict, and then also not private healthcare givers not knowing the protocols to adopt or to follow.
Well, in the first place, meetings have been held with private practitioners, and the main message is recognize the have an index of suspicion. And we commended the doctor in Abeokuta who saw the index case that came in here. He looked, I believe he did a malaria test. He wasn't convinced, so immediately he referred the patient. Now, we warn all private practitioners, if you don't have the facilities to manage a case that you suspect, send them on. Don't hold on to. The longer you hold on to that patient, the greater the problem will be. So if you send them on immediately, as the doctor did in Abeokuta, you can have very good results. It helped us very much to be able to limit the time frame within which that index person could have infected more people. So that helps us, and the message again to private practitioners, once you are not sure, refer. You might not have the facilities to treat. We know that most patients who need medical attention go to a private hospital. If you are suspicious, send that patient on. That's the best you can do. There's a call number that has been disseminated many times, 0800 970000.
Can you take that again?
0800 970000. It's relatively simple.
Yes.
So it's a number you call and you get help. It has been, and I use this opportunity to disseminate it again. The number you call, you tell you exactly what to do. So I believe that the guild should also spread it among themselves. Don't try to hold on to a person too long if you are not sure. And they immediately call that number. They will tell you what to do. In fact, they will send a team to take a swab. And that is what they do. That's what happened in Lagos. The team comes to you, they take a swab, do a test, and then if the patient is positive, they come and pick him up from you.
I'm sorry, Juma, I was just going to say, because yesterday again, I mean, we dwelt on this. The metaphor of war is being used to describe the response by various countries to the coronavirus pandemic. And part of the comments made by Dr. Tabo and Babalola, and indeed Abimbola, refer to the fact that, okay, fine, you are having the preventive measures. Again, I would like to repeat this. You are having the preventive measures. Suppose there are breaches of those preventive measures and people slip into the larger population. They are asking, for instance, say, look, on their own, they could support public health facilities by having, one, the protective gear in the first instance, and then by having select hospitals that will serve as isolation centers. I'm sure you've read about what was alleged to be the scandalous state in which the woman who was suspected to have coronavirus was kept, in some dungeon somewhere in Enugu, which the daughter claims probably aggravated her underlying circumstances. So they are calling for collaboration. Have some select centers. It doesn't have to be the federal government. State governments could also take that. What's your reaction to this, Honorable Minister?
My reaction is that even before the index case came in, we were already looking at isolation centers. I personally visited Lagos to check out the isolation center there. I visited Kano, checked out the isolation center. And I visited Gwagwalada, where the isolation center is a standard one, was under construction. It started before this case came up. And that is a model we are going to use to replicate isolation centers all over the country. But it takes time to get this working. So we have Plan B, which means that we are using certain wards and certain wards of hospitals. And working with certain teaching hospitals to make rooms available in case there's an emergency or a spillover.
Okay, Honorable Minister and our guest, we have a report on the isolation centers and the numbers. I think we'll play it right now. When we return, the conversation continues.
This is the Esut Colliery Hospital, said to be the isolation center in Enugu, where patients with suspected cases of coronavirus and other infectious diseases had to be isolated and quarantined. When NTN News crew visited the said isolation facility, they were denied access into the center, and efforts made to get the officials of the hospital to speak did not yield positive results. However, it was gathered from the letter making the rounds in the social media, purportedly written by the daughter of the woman suspected of the COVID-19 in Enugu, that upon her return to Nigeria from her visit to UK on Wednesday, 11th of March 2020, she exhibited some symptoms of the coronavirus and was taken to the hospital on the 13th of March, while her blood samples were collected on Saturday, 14th, and proved negative on the 15th of March.
The good news is that the sample came back from the Rural Specialist Hospital at the late hours of Sunday, and as it were, the result turned out to be negative. So the state at large, the Emergency Operations Center, the Ministry of Health, and the government of Enugu State are very, very happy with that development. But again, it has set the pace, at least to test the preparedness of the state, which we've seen that is very, very, very optimal.
Even though the blood sample tested negative to COVID-19, the woman was said to have died, having been isolated in a dilapidated environment that seems to have been left uninhabitable over a long period of time. When NTN News crew put a call across to the Enugu State Commissioner for Information, as well as the Permanent Secretary, State Ministry of Health, they said the state government has summoned the management of the hospital to find out what actually happened and would brief the press on the outcome of the meeting. Also in the letter, the daughter of the said woman is asking why the Enugu State government had to wait until the news of the suspected case of the woman with COVID-19 before responding by releasing 20 million naira for the management of the state isolation center. The new strand of coronavirus was detected back in December 2019, and the state government had before now assured residents of Enugu that it has an isolation center that is optimally ready to deal with any case of coronavirus and other emergencies.
They've activated their own, emergency operations center.
The state government encouraged the residents to ensure the highest level of personal hygiene, especially the hand and respiratory hygiene. In Enugu, Chineye Nwoye, NTN News.
So much concentration, as you can see from this report, on Abuja and Lagos. What is this level of synergy between the Ministry of Health Federal Ministry of Health and the State Government Ministry of Health?
We work very well with the state governments. We pass messages on. As I told you just now, I visited Kano Isolation Center. I went to look in there, and I've seen the one in Gwagwalada. That is even before the index case came in. And Lagos, I inspected all these places. In fact, Lagos is also building a brand new isolation center. But the point with isolation centers is that we are beginning to change the tactic. You don't build an isolation center far away somewhere. In those days when you had smallpox and all these kinds of diseases which you had to keep people away, you had them somewhere where they fall into disuse, because it's not every day you have these kinds of epidemics. Now we're looking at, like you have in Enugu, in Gwagwalada, the isolation center in a teaching hospital. It can be, in fact, used for anything else, but the day you need it, you vacate it and then prepare it for use. And it's ready and in good shape at any time. So in many states, there are places where they have isolation centers. In fact, there are active isolation centers, as I speak to you, for TB and various other. But you can't put all infected cases together. In Iroa, they have one of the very best isolation centers for Lassa. But if you have an all-purpose isolation center, which I think every state should have, and make it ready, they should be inside a facility that is able to provide the services that you need, where it can be properly maintained and kept ready at any time. So it is true that some, like in Enugu now, may at a point have fallen into disuse. I haven't been there. But trying to activate it is probably a challenge. And I believe that most countries fall into this same kind of problem.
All right, Dr. Abimbola Silva, let's have your take on this. I mean, what information are you getting from your colleagues elsewhere in the country in terms of level of preparedness and what concerns they have or what is being done right?
Thank you very much for that question. When the NCDC came to give a training to the Guild of Medical Directors in Abuja and in Lagos, we were instructed that our main duty is to try and screen, isolate, and then notify. Now, once we notify and the criteria is checked and they agree to come, and they think the patient should be tested, NCDC will come to your center and collect the sample of the patient and then wait for 48 hours at least to get the results out. Now, if you think about the logistics of all of this, you should be able to safely screen, you should be able to isolate wherever the patient has come to you, and then wait, keeping the patient still with you while we are waiting for the results to come out. What I'm getting, and just like my Prof and Dr. Taba have said, even the hospitals are not prepared to be able to keep the patient while we are waiting for results. Because that's what NCDC asked us to do. Screen, isolate, and notify. And then wait for the results to come out. So you wait 48 hours, the patient is with you in that time. And then when the confirmation is, if the confirmation is there, then NCDC will come and pick the patient from you. But in 48 hours, you have to be able to still contain the patient within your premises somehow. We have been told now that we should refer. Nobody really knows how to treat coronavirus now. Since there's no treatment, it's mainly supportive care. So if are we just like Professor said, are we to screen, isolate, and refer immediately, or in those 48 hours, something still has to happen to ensure that patient doesn't infect anybody else? Staff in the hospital, other patients coming for treatment who don't have coronavirus, at that period. So this is why we're saying that if everybody knows that there's a safe isolation place, for example, now I think Gwagwalada is what we know of the isolation center. I know some of my colleagues are sending patients to Gwagwalada. Imagine sending a patient has come to you, you suspect this is the problem, and you refer them to Gwagwalada. Some of these patients make a stopover at home and plan to go to Gwagwalada the next day or the day after, and along the line may still infect some people. If all of this is if, I'm just painting.
Yeah, no, scenario sketching.
Scenarios, So if before they eventually get to Gogalada by themselves. They may delay and go to Gogalada in 3 or 4, 5 days or 6 days, and then they would have done a bit of spreading before they eventually get there. So I'm just wondering, just like Prof has, such, and like you have also said, if there was an isolation place, and just like the Honorable Minister also said, isolation place that we all know about within the city, that you can immediately say, okay, let's isolate you there while we are waiting for results to come out, especially because you're a suspect. I think that may help us more.
Dr. Otaba, what does this do to practice?
Thank you so much. Coronavirus is an emerging thing, and things change rapidly under this pandemic. And we have to keep pace and, in fact, be ahead of the virus for us to save as many lives as possible. We must anticipate the problems and plan to solve them before they come. For instance, the U.S. President approved the release of 2 hospital ships to treat normal patients because the system is overwhelmed such that the normal hospitals are being taken over by coronavirus patients. It might get to that situation very soon, maybe in a couple of weeks, God forbid, but we should also think about it. That by the time you are having 2,000 patients coronavirus all over the place, I mean, the normal hospital setting will be overwhelmed. What is the plan in this circumstance? It's good to prevent, and we are doing everything to prevent, thanks to the federal government for banning the flights and all that. But something tells me that the preventive measures have been breached, and the problem is with us right now. What do we do? Every one of us here, we are consultants and specialists in our own right. We are also involved in private practice. We are not convinced that we are ready. I think that the federal government should engage stakeholders beyond just, talking about what NCDC is doing and trying to prevent. Call the people who would be seeing the patients face to face and ask, what is your capacity? What do you need? What do you anticipate will be the problem? So we come together and discuss, and then we paint case scenarios. That's what we should be doing. But just to think of prevention, we have passed that level. That's the truth. Because cases are coming. And by the time you have 2 people infecting themselves within the community, then you know that the time is up. They said the best time to have planted the tree was 20 years ago. But the next best time is now.
Who are the stakeholders you have in mind?
Now, the private hospitals, the government hospitals, the laboratory centers, all those who are involved in caring for patients. For instance, how many intensivists do we have? Because when it happens, you have people quickly coming down with respiratory distress, and they need to be supported, to go over that phase before they recover. So how many people can we put on ventilator at this time, T? Let's say in Abuja of about 5 million people. I'm not sure that we can have more than 100 people on ventilators in this Abuja at any given time. But there could be a situation where you will have like 700 to 1,000 people requiring ventilator care. So what that means is that all those people will just be condemned to die.
Well, I'm just wondering. I mean, this is we're sketching a scenario of crisis. We aren't there yet, but as you said, it's useful to plan, ahead just in case the dam breaks. What's your take on this? The Honourable Minister has already responded to some of the issues that you raised. What further concerns do you have which you would like addressed?
Well, basically, I've always called for better collaboration between, the private sector and the ministries of health, both at the federal level and at the state level. And I've always said that the Minister of Health is a minister not just for the federal tertiary hospitals, but for all private hospitals in the country. If you look at the scenario in the UK, for instance, private hospitals or private surgeries, as they call it in the UK, are closely integrated with the overall healthcare, practice in the country. So that by definition, your first line of call as a patient living anywhere in the country is your GP next door, and not the teaching hospital or the tertiary hospital. The tertiary hospitals take cases from you only when you cannot cope. And this is what we are, agitating for in the country as well. I believe that this coronavirus issue has just further highlighted the need for better collaboration. We have been calling for meetings with the Federal Minister of Health, but he has been a bit busy. I hope that he will eventually find time to meet with the private hospitals. But just like Dr. Otabo is saying, unless we have that synergy, we're not going to be able to cope with this problem. Like I said, the likelihood that the cases will come to a private hospital are much higher than doing to a teaching hospital. The cases will come to us first. We don't have information. We don't have all these things that we need to cope with this situation. Just the reason why I brought Dr. Bimbo to be with us today is because she was the person who organized our meeting with the NCDC. She was the one who pushed for it, for us to have those meetings. And I also, incidentally, one of the NCDC people is a member of my church, and I, impressed on her that there was a need for you to train, private practitioners, both in Abuja and Lagos, before that meeting held. And as far as we are concerned in the Guild of Medical Directors, Bimbo that you are seeing there is our expert. She's the one who knows. She's the one who has collaborated with the NCDC, and you can hear what she's saying. The scenario that they give her is that patients come, they are isolated, so we have to have the means to isolate in our facilities. And what I'm trying to say here is that not every hospital can develop that capacity to build isolation centers. You understand? Because the capacity of private hospitals varies. Some are stronger than others. And this is why I was saying that, okay, let us look for some hospitals, maybe on the advice of the Guild of Medical Directors, that will say, okay, these hospitals have the capacity to build or to construct isolation centers, either by themselves or with aid from the federal government, And then the Minister of Health knows that, okay, apart from Gwagwalada, there are some other hospitals, within the city, to which if Dr. Otabo sees a case in his hospital, for instance, he can say, okay, I'm suspecting that this patient has COVID-19. Let me send to the hospital that is designated to isolate while the testing is being done. The issue of treatment is another thing, of course, and this is where I think the teaching hospitals will then come in, because the ability to teach, to treat, to put on ventilators and so on and so forth may be beyond the capacity of some of the hospitals, so private hospitals, but certainly, the teaching hospitals may be able to build that capacity.
Okay.
So,
no, continue.
So this is why I'm thinking that we should begin to think along those lines, so that if it should come to, like Dr. Otabo was saying, if we suddenly have 2,000 cases in Nigeria, we're not going to be able to cope as it is. So, but if all our energies are harnessed, whether they're in the private or in the federal government or state government side, then I think together we can all work together to handle this.
I hope,
crisis.
Dr. Babalola, you're not having an elitist view of this. No, I'm just wondering, before Jumai pops the next question to the Honorable Minister of Health, we keep referring to Abuja and Lagos. Nigeria's population is spread all across. So that it doesn't become a case like some of the cancer treatment facilities that they say only when you come to the national hospital that you can have cancer treatment. When that machine breaks down,
even that is not enough.
It's not enough. So let it not make it like it's only Abuja and Lagos. You have people elsewhere, so that those who are watching us from Sokoto, Kano, Meduguri, Jos, Pangshin, and other locations, Mina is close by. We'll have a sense that they're also being discussed.
Yes, absolutely. You see, because to be honest, the spread of private facilities is the widest in the country. You understand? There's hardly any town you go to, or any village, or any city, moderate size, big size, that you do not have private, hospitals there. And certainly, this is why I'm saying that once, the private hospitals are engaged at the national level, then we can then disseminate all this information to our members, and we can work with them and see how they can fit in. We can feed them direct information as to, okay, if you do have a suspicious case, maybe in Kotangura or wherever your hospital is, this is what you are supposed to do.
Yeah.
Because all our members have been trying to, link up with those at the national level and say, what do we do when we have cases? I don't have the answer for them at the moment.
Okay, Honorable Minister, there's so much talk about equipment, isolation center, but the big question is the managers of this disease. Are we manpower equipped to handle it?
Well, we can't answer that question without going back to what the private practitioners have said, in that quite apart from facilities and space, you need expertise. If you do not have the trained nurses, the trained doctors, no private practitioner should be thinking of managing a case like that. So the best thing you can do is consult. If you have the index of suspicion, refer. It has been said so many times. And as the saying goes, if you didn't hear the news, then there was no news. Bimbo just said just now that there was training here in Abuja and Lagos. Those are the two hubs where we really expect
And Kisley
the main
says
airports.
Abuja and Lagos, there are other parts of the country.
I know, but I've said already that the main, this is an imported problem, and the main airports are Abuja and Lagos. We know very well that it can spread to other areas, but secondarily. So the primary problems and most of the traveling population will be in these two places. And events have proved us to be correct. Most of the testing is in these places. But what we expect from the private practice group is that once you have an index of suspicion, don't hold on, send to the one you know. There's a number, it's been disseminated every time. We hold a briefing 3 times a week with the press to keep the public abreast of what's happening, because knowledge is going to be part of what we need to fight this disease, and also fight ignorance and fight misinformation. But as far as equipment is concerned, yes, our first line of defense is prevent. Secondly, detect. And thirdly, handle. We have involved all the teaching hospitals. We have told them, make one ward available at short notice. Be ready to do that. Get all your equipment functional. Secondly, we have received money, which we have had a shopping list. We have sent for equipment. We've ordered things. They have to come from outside the country. We don't manufacture most things. Although we are making hand sanitizers now. An agency under the ministry is making hand sanitizers. So we are trying to prepare on every front. But we must use a strategy, rely on our public health experts. I'm a surgeon, I'm not a public health expert. So I'm on the phone every time with all the public health experts we have who are running, and those with hands-on experience, to see how we tweak the situation, our response to the situation as it arises. He was correct. It's changing all the time.
Yeah, I was wondering, just, so that, gentlemen, again, this is something that we often refer to. I mean, the federal government is taking the lead in this. What has the National Council on Health done with respect to cascading this down to the subnational levels? Here we're talking about commissioners for health and what they're doing. We've read 1 or 2 stories of a state government setting up a committee and giving them 10 million, to go and do some things. I don't know. What are you getting from?
Every state has an EOC, Emergency Operating Center, which connects with the State Ministry of Health and the State Public Health Department, and they work with them. The case that came in, the index case that came in here, followed up very diligently, tracked all the people who were at the aircraft, all the people they had contact with, 19 of them in Lagos, and I think 39 or 40 in Ogun State. That's where he came for his consultancy.
Does it include the crew of the ship, of the plane, the pilots and the crew?
No, the plane has gone back to Turkey. But again, what the Public Health Department does is to send the airline and the embassy a notice and say, look, this plane came with someone who had coronavirus. Do the needful. They know what to do. Public health advice system. Disinfect the plane, look after the crew. On our own here, those travelers who left back to other countries were detected and their embassies were informed. But those of them who were here in Nigeria, they were tracked and found. Some of them were in different states, in Edo and so on. They were tracked, they were put under the care of the state public health department and observed for the 14 days that was required. Now, the private practitioner who saw that in this case did exactly the right thing, referred him immediately, didn't hold on, didn't say, well, let me try this, let me try that. So, and that one saved the situation. We commended him for that already. And then the result usually comes out within 6 hours, not 48 hours. 6 hours you can get your result. And even if you need to repeat it, you can repeat it in 48 hours. But you get your result very rapidly. What we do in between is a matter of design. We're trying to design what we do, how we respond. We know that the first port of call will probably be a private hospital. And our advice is try to call the number if you suspect. Call the number. It has been done. Many people are doing that. Just last night, I got a text from Gwagwalada that they had 4 patients being tested. You know, they are referred from private hospitals.
Okay, Honorable Minister, we have to
It's an issue that will keep coming back to. The central bank has already announced a grant or a loan, I'm not sure how it is categorized, of 100 billion naira. It's a 100 billion naira intervention for this. How would you like to see that money spent?
Whose question?
Yeah.
Yes.
Okay, in terms of healthcare?
Yes.
Yeah, there are so many fronts. I listened to the CBN governor talk about it. There's the fund is for expansion of private hospital facilities, because whether you like it or not, the private hospital is the cornerstone of healthcare in Nigeria at the moment. The teaching hospitals, they have their role to play, but more patients go to the private hospitals. If we are going to be effective in the treatment, not prevention of coronavirus, the private hospitals will have to be involved in the treatment. It's not about testing and sending. I beg to disagree with the Honorable Minister a little bit on this, because I know the capacities of the teaching hospitals. Some of them don't even have 2 ventilators. And there are private hospitals who have as many as 6 ventilators and doing big things. This is the collaboration I'm talking about. It's beyond saying send to teaching hospitals. Many of the patients, if they send them to the teaching hospitals, we cannot guarantee what will happen to them because the capacity is not there, as it were. So we need the collaboration on all fronts. So if the CBN is making funds available for this purpose, they are talking about the private hospitals. Private hospitals can acquire more space, build more structures, equip, and then be ready for the battle. So I think that this is the way to go. If it was to the government hospital, I'm sure the CBN governor would not be talking about the grant. It's to the private hospital. They should make the process of getting these funds easy, so that private hospital can acquire the funds and be ready to take on some of the challenges that will come from this pandemic.
Okay, thank you so much. We have a number of tweets Nigerians are contributing to the conversation. We'll take it quickly. Omobola Babs tweets, better late than never. The travel restriction from high-risk countries and unofficial purposes is a welcome development. However, government should go beyond advocacy. Those who came into the country in the last 2 weeks and may have likely been exposed to risks should be traced and monitored.
All right, we have others, Festus Akimboyewa, Dele Jack Solomon, Mike Kanya Kwo, these regulars, Ibrahim Oduwaji also has a tweet here. That's Ibrahim Oduwaji. Let me read this very quickly. It says, Nigeria needs to shut down other airports with the exception of Abuja and Lagos, and let's have quarantine centers where travelers coming from pandemic countries will be directly quarantined instead of self-isolation.
Yes, and we have Steve Bond, 007 Abdullah, and Atek Sagir Abba Tukur. Generally speaking, I expect the federal government to take drastic measures on COVID-19 since day one by closing its borders for the well-being of Nigerians. Though it is not too late, the federal government must work tirelessly to ensure the safety of all Nigerians. I think that's about the number of tweets we can take now.
That's right.
Kisley.
All right, yeah. So that's we'd like to thank you, Cecilia Kuruma and Umar and others for your tweets. We have a second topic, by the way, and so that's why we're having at this time to thank all our guests who have been with us on this conversation. Dr. Abimbola Silva, she's a member of the Guild of Medical Directors. Thank you for being with us on Good Morning Nigeria today.
Thank you.
We also would like to appreciate Dr. Femi Babalola, who is President, Guild of Medical Directors. Thanks for being on Good Morning Nigeria. Dr. Christopher Otabo, also a member of the Guild of Directors and a consultant orthopedic surgeon. Thanks for being with us on Good Morning Nigeria today. Dr. Osage Anere, also a surgeon, Honorable Minister of Health. Thank you for being with us on Good Morning Nigeria. You have a closing thoughts?
Well, closing thoughts again are the same thing I said before.
All right.
Managing a case like that, you see, we don't even manage them at the teaching hospitals. We manage them in an infectious disease hospital where there's a protocol set in Lagos. They don't go to Luth or anywhere else. And I would not advise any private practitioner who doesn't have the full, even if you have the space, you don't have the complement of staff to try that. You run the risk of infecting other patients and infecting staff if you do not have a full complement and a protocol.
All right, Minister, thank you for being with us. It's Good Morning Nigeria, still reaching you live on the network service of the Nigerian Television Authority. We'll take a short break now. When we return, we'll be discussing the slash in the pump price of petrol, now 125 naira, down from 145.
Move now! The red light won't kill you! Move now!
To dey disobey traffic law, dey cause accidents. Me, I don't talk, say I no go dey do am again because change begins with me.
Cross the other side of the road.
I will no longer endanger my life crossing the express. Instead, I will use the bridge because change begins with me.
Oga driver, stop this bus now, won't come down. I be one carry me pass where they go.
Make I dey stop anyhow for road, dey cause traffic wahala and accidents. So I go dey stop for the right bus stop because change begins with me.
Change begins with me.
This message is brought to you by the National Orientation Agency in conjunction with the Federal Ministry of Information and Culture.
You are watching NTA, Nigerian Television Authority. For more information and news updates, visit our website at www.nta.ng, or you can follow us on Twitter at NTA News Now, or you can like us on Facebook at NTA Network News. Stay connected on our YouTube channel at www.youtube.com/NTA News Online. Watch our live stream at www.nta.ng/live. NTA. You can't beat the rich.
All right, you're welcome back, and Good Morning Nigeria. We indicated earlier that sequel to the global fall in oil price due to coronavirus and, of course, the spat between Saudi Arabia and Russia, President Muhammadu Buhari has approved the immediate reduction in the pump price of petrol from 145 naira per litre to 125 naira per litre. Of course, this information came yesterday at the end of the Federal Executive Council meeting. Here with us in the studios to discuss this issue and matters arising therefrom, let's welcome our regular guest, Niyi Akinsiju. Niyi Akinsiju, of course, an investment and financial analyst. Niyi, delighted to have you.
Always. Thank you so much.
Also here with us in the studios is Amina Mena. She's the Group Chief Operating Officer of MRS Holdings. That's a business in the oil and gas sector. Amina, pleasure to have you with us on the program.
Thank you very much.
Thank you. All right.
Yes, just yesterday, Nigerians woke up to the, presidential order that, the PMS money to be paid when you buy petroleum has been reduced by the federal government. How are you going to comply with that?
Well, I mean, first of all, it's a welcome development because I think that with international prices crashing, it was inevitable that the petroleum price would also crash. We've been directed and told that the pump price should be adjusted from today, and naturally we will comply. It's not even something that... But I think that people need to understand that there's a process to changing the pump price because it's not the people who are in the stations that can just go and adjust the meters. But all the technicians are out already. We've directed everyone, go out and start to do what you need to do. But we have to send engineers who can go out and make those adjustments as needed. So you will start to see those changes today. And we're going to meet with government later on in the day to understand fully how this implementation will be done and how fast, because I think your colleague mentioned earlier on the program that people already hold stock in their facility, which we had priced at higher prices. But we're not concerned about that right now. Our concern is really ensuring that what government has asked us to do is done. And we know that government is considerate, and I've always kept their word that we'll be able to work out the modalities as to how we cushion whatever losses we may have.
All right. Thanks a lot, Nii.
I think for me it's about opportunity cost, because the government had a choice in the face of projected, of course, dwindling revenue and all that, not to change the price, the pump price of PMS, because really we've had a subsidy regime. Well, what we have in now, of course, is decline in the price of crude oil, reflecting, on landing cost and all that. The government could have said, it's time, since we're going to lose so much from crude oil face value, let us use the extra, that we can save as income for the Federation. So by reducing the pump price, it is to say that we are also sacrificing this much for Nigerians. And I think it has to do with creating the comfort regime for Nigerians. It is proactive. In the reasons of it, we've not been hit, by perhaps until yesterday when these 13 countries were barred from coming in. We have not been hit by the consequences of coronavirus. So I think creating this comfort environment is a way of empowering Nigerian households going forward, because this will reflect in transportation costs, it will reflect in logistics for companies, it will reflect in enhanced demand capacity for households and all that. And I said a 20 naira difference goes a long way, especially when you start multiplying by weeks and months. If you use 10 liters a day of PMS and you are saving like 200 naira, across 10 days, that is 2,000 naira. Across 30 days, that is 6,000 naira. And you can go on and on. And what it does is that you are saving money on PMS to buy things, And of course, as we also look, at possible cases of depression in terms of demand, savings like this, because they are truly savings like this are those elements that will help our demand push, as it were. So I think it's good as we create that comfort regime for Nigerians as a whole.
Is it? Let's get this clear. I mean, we're not. The numbers haven't been fully disaggregated, at least from the reports that I have read since the announcement came yesterday. First, with the speculation as to what the actual slash would be. Does this now amount to an end of the subsidy regime or under recovery of costs? Is that what we are seeing?
I don't think it's an end to subsidy regime, because what the minister said specifically was modulation, and of course we know who introduced that
price modulation.
you know, so it's price modulation. You modulate along movement of price of crude oil, the basic product, as it were. So I think all other elements in the pricing templates are constant. You know, the difference would just be the price of crude oil in the international market. So I don't think it's about removal of subsidy, because if you also extend it by what the government is also doing in reviewing the budget 2020, the money set aside in the budget for recovery, for under recovery, is also slashed, it's also reduced, you know, in that review. So I think basically it's also target, you know, that under recovery, and also use it again as a floor, you know, for the review, as it were.
I don't know, you were sounding rather optimistic that transport fares will be slashed, but we know that with respect to transport operators, I'm not saying this to malign you, but we know that there are profiteers all over the place. Yes. It is, you know, it will be difficult for them to reduce their fares, and they will tell you that, you know, the fuel I bought, you know, is 145, that is one, and it goes on and on and on and on, and even if they are going to slash, it will not be by any sufficient margin. Whereas if the price went up to, say, 150 naira this morning, the price would have doubled.
Just by 5 naira.
Yeah, so why are you optimistic, or what needs to be done? I mean, that's the most pertinent question. What needs to be done to engage, you know, transport owners and transport operators to take a cue from this, and then have a knock-on effect in terms of the fares that they charge?
Just as Chief here had said, there's going to be further consultation with petroleum products marketers, as it were. And I think at the level of transporters, you have two major union or association of transporters, the NOTW, National Union of Road Transport Workers, and the Road Transporters Employers Association or something, NATO. So you expect that there will be a form of consultation at different levels, from the federal government to the state government and all that. And I have also been observing a kind of collaboration, really, a kind of engagement between these associations and, this union, and of course the government at different levels. So the important thing is for government to be committed for a reflection, you know, of this policy on the Nigerian people. And in doing that, you need to actually consult these unions, as it were.
You know, the economy has been hit hard already, and it's good news for Nigerians that the fuel price has been reduced. But how will it impact the economy now?
Well, I mean, to start with, like he mentioned, the issue of under-recovery. As you know, there's been an amount in the budget for this year for the under-recovery. That amount will no longer be budgeted for, because the prices have come down to a point where you don't really need the under-recovery. So that translates automatically to a saving. If I remember correctly, I think it's 1 trillion naira or something like that in the budget. So that means that we do have 1 trillion naira available now for other critical areas that government needs to look into. Additionally, it may take a while, but like he's pointed out, road transportation, which drives the prices of everything. If you go to the market woman will tell you, oh, you know, the cost of transport is high, so that's why my goods are expensive. But you're going to see all of that reduce. You're going to see a situation where, with the crude prices today, and hopefully it remains this way for some time, the entire industry, the oil industry in itself, will come back on stream. You're not going to have NNPC as the sole importers anymore. You will now have private sector participation, which then translates into job creations for other people. You know, people will be able to start to work again, and by doing that, at least we're adding to the economy, because you have people who are being employed. Whatever they earn at the end of the day would go back into the economy, and we'll hopefully start to see things turn around again.
I'll come back to, you know, getting more importers into the mix. But one very urgent question to ask is, okay, this is the decision that the government has taken with regard to PMS, which stands for Premium Motor Spirit, also known as petrol. What is the effect of the crash in crude oil prices on the price of diesel, AGO, automotive gas oil?
So if you take diesel, for example, because that's fully deregulated, you will find that starting from last week actually, most private depots had reduced their prices because that is a product that is not regulated or there's no under recovery. So you see that sort of automatic reduction because the product is priced in line with the market. Now with PMS, because it is modulated, there's a level to which you can go. You can't just get up and say, I'm going to go and import. When you look at the template, there are elements in the template that are really controlled by government. So as private sector people, we can't just get up and decide, well, I'm going to import without knowing how I'm going to recover my cost. Whereas with diesel, you don't have that. So you would see from the market that from last week, diesel prices had crashed already.
What numbers are we looking at?
For diesel?
Yeah, for diesel per liter.
Today, I think diesel is selling in the range, at least ex-depot. I'm not sure what the stations are doing, but ex-depot, you have prices have come down to about 170 naira per litre. Whereas before all of this, we were looking at a range of anywhere between 190 to 200 naira per litre. So you can see that already. And as long as the prices continue to drop, you will continue to see the price drop also.
That's good news for business owners. But the announcement yesterday, did it come at a shock to private marketers?
To be honest, I mean, personally, I was not shocked. I can't speak for everyone because this is a responsible government, right? And we knew that it was going to come. Government is responsive. Government is considerate. As long as prices drop, you need to see that also translate into the lives of the ordinary man. So if it didn't come yesterday, it probably would have come today, but it was definitely something we were expecting.
Well, always a contentious point is, the pricing regime, investors are not confident when there is a cap, when the system is not deregulated. But we have seen this being acted out now with a drop in crude oil prices. Okay, the government is saying, look, slash petrol to 125, and there's still a reasonable margin. And are talking about opportunity for more importers to come. When are we going to see investment in refineries from the private sector?
To be honest, I think that's a policy issue, and it's a very delicate issue, so to say. No marketer would say that I'm going to make an investment when I'm not sure of the policies that govern my investment. So you will start to see that when basically the forces of demand and supply determine prices. Petrol is something that is very sensitive to nearly every Nigerian. If government woke up today and said, well, we're going to stop the price modulation and just allow everybody to import like they do with diesel, Nigerians will kick back and say, oh, but we're a country that produces oil, why are we not refining? But then the flip side of it is that no investor wants to go, you're going to take a loan from a bank. You need to know how you're going to recover that money, because when the time comes, the bank is not going to say, oh, well, there was a regulation by government which stopped you from selling to recover your cost. So until we get to that point where Nigerians actually believe that government is doing everything possible for us as a nation and allow government to focus on things like regulation, maybe with the passing of the PIB, we would see, more enabling environment.
In other words, full deregulation. That's the bottom line of what you are saying. Nii, very quickly.
I think the Dangote refinery had given us a new prism, to look at this issue. We are going to have the biggest refinery, in Africa. And perhaps more than that, my argument against this logic is that PMS is not the only product of crude. You have so many byproducts. I think these byproducts are also as profitable as PMS. And there should be enough motivation, actually, to have private investors, investing in refineries in the country.
Okay, thank you, Nii Akisiju, investment and financial expert. Thank you, as usual, for your input. And Amina Maina from the Oil and Gas Sector Group Chief Operating Officer, MRS Holdings. Thank you so much.
Thanks so much
for coming on Good Morning Nigeria. Well, Kingsley?
All right, so that does it for us today on Good Morning Nigeria. We thank you for being And to us, tomorrow we return same time, 7 o'clock in the morning. Until then, do enjoy the rest of your day. I'm Kingsley Osadola.
And I'm Juma Yusuf. Have a great day.